Welcome back to Great Day Medical Monday. Dr. Julio Arroyo is with Eye Health Consultants, and we're also here with brothers Diego and Davian, who are two of his patients. All right, Dr. Arroyo, I remember vividly in third grade, I kept moving closer and closer to the chalkboard, and it never dawned on me that maybe I'm moving closer to the chalkboard because my eyes have an issue.
Absolutely, and that's called nearsightedness, myopia. Now, 40% of American kids have myopia. It's pretty much an epidemic.
Yeah.
The problem is that it's only getting worse. And what many doctors don't know is that we can actually slow down, even stop that progress with the new technology that we're going to talk about.
A lot of kids are going back to school, and so they haven't been used to really kind of dealing with things like having to see a chalkboard, so they might not realize there's a problem. This points to the importance of children need to have an eye exam. How often?
Well, we say once a year, particularly after school, because around 6, 7 years old, that's when myopia starts to occur.
Yeah. All right, so Diego and Davian, when did you realize you were having problems seeing clearly?
I was at school, and then I was struggling to see, and I told the teacher, and then they told my parents.
Yeah. Did you think it was your eyes, or did you think that it was just because you're too far away from the board?
My eyes.
Yeah. So you realized you were smarter than I was. All right. And for you, what was happening?
Things just started getting blurry, and then I told my mom.
Yeah. And of course, when that happens too, some signs that kids might not be seeing well is headaches. And things like that could occur as well, right?
Correct. And you see these kids that don't see well, but they think that's normal. So they are just looking at the board, and they are not making up the words properly. They are not capturing the information, because actually 80% of the information comes through the side, through your eyes. So they're saying, well, I guess that must be the way it is. And actually they're falling behind school and all kind of problems.
My option back then was to either have a hard contact, which I didn't want to do because it was uncomfortable for my friends, and then also glasses. So that's what I had. I had glasses, but I was playing sports. I get hit in the face during basketball or something, and the glasses would break, or I'd set them down on a table and I'd lose them. The other option for kids today, of course, is a soft contact lens all day. But the problem there is too, if you're playing sports, somebody hits you, it's out. You have allergies, you got issues. There's another option that's really cool. And literally, when we say sleep and see, you go to sleep and you wake up and you can see.
That's exactly right. This is the exciting thing about corneal molding. We can actually have kids that are naked eyes 20/20, no surgery. We are protecting their visual future, because it's a gold standard to make sure that their prescription, their nearsighted, doesn't go up. If you wear glasses or regular contacts, the prescription goes up categorically.
Your eyes can get worse.
Every year.
Yes.
Every year. And that's when many parents settle for it, because the doctor said, well, that's all we can do.
We'll just give you another prescription. We'll just make it stronger.
Exactly.
Okay.
When you're older, you can have LASIK. But really, by the time they're old enough, they don't even qualify for such a thing as LASIK. So we can actually protect their vision while they're asleep, while they're young, with their naked eyes.
Let's show how the corneal molding is what it's called again, and let's show how that works. So basically, it's like a harder contact lens, right? And when you say corneal molding, it's just like the name sounds. For teeth, the corneal molding can do for the eye, but much quicker, because the eye is a soft tissue, so it can transition faster. Okay, so I've done this as well, and to me, it is. I always say it's like a magic trick. It's amazing. So you put the corneal molds in your eye, which they look kind of like a contact, but you put it in your eye at night. You went to sleep, and the next morning, what happened?
I was seeing better.
Yeah. And then for you too?
All I saw was clear, nothing blurry.
All you saw was clear, nothing blurry, right? And the cool thing about that is that, did you wear glasses before ever?
Yes.
Yeah.
Me and my brother, we used to always break a lot of them, because since we played football, baseball, and basketball, we used to always break them.
Yeah.
And football was the worst, because putting on the helmet, it always went up or down.
And then if you're sweating, your glasses would all come down too, right? Yeah. And then did you ever try like the regular soft contacts every day?
Yes, I did. And then after one game, we were playing an away game, my contact popped out, so I was only with one contact to our way to our house.
And everyone thought you were winking at them.
No, it was like when we were already done and everything, and then it popped out and it landed right here, and I was like, I need to go to my mom.
Yeah. And then did you ever wear the soft contacts? Yeah. And sometimes it's kind of hard, even dexterity-wise, for younger kids, Dr. Arroyo, to wear that soft contact. And then, of course, kids don't qualify for LASIK, right?
That is correct. Yeah, and they are still young. By the way, they're such precious kids, and they're so smart. You get to have a conversation with them, you realize how. And it's so interesting because many myopic kids are very smart as well. So anyway, not that others are not, but it's particularly important, interesting this pattern. Regardless, the sooner we catch them, let's say 7, 8 years old, and we stop them there, they don't get to be 7, 8 doctors when they're older.
Right.
So the sooner we see, okay, they are myopic, let's stop it. Now, self-esteem, sports, visual freedom, visual performance at school, all kind of issues get better with corneal molding.
And not having to go home and say, Mom, Dad, I lost my glasses again, or I broke my glasses again. And let me just mention, we're talking about kids in particular now, but the reason why I use them is because seeing close up, which happens to most all of us as we age, became really hard. So you can use them on adults as well. If you're having any kind of visual problems, you can take a look at this. And again, literally, you go to sleep at night, you wake up, and as you said, no blurry, all clear. All right, thank you very much. Dr. Arroyo and Eye Health Consultants has a special offer for Great Day viewers. The first 25 callers will receive $300 off corneal molding when they mention Great Day Houston. To make an appointment, call this number. It's 281-419-3355, 281-419-3355. And for more information, log on to sleepandsee.com. And sleepandSee.com is as easy as it is. You put them in your eyes at night, go to sleep. Next morning you wake up, everything's nice and clear.